Hello everyone, let's begin our class. We will learn the contents of acute myocardial infarction. I'm from Department of Cardiovascular Medicine, the first hospital of China Medical University. Part 1, the concept. First of all, let's review these contents. The myocardial infarction is the major contents of ischemic heart disease. Another concept is the acute coronary syndrome. It includes unstable angina pectoris, non-ST elevated myocardial infarction, and ST elevated myocardial infarction. The first two ones can also be called non-ST ACS, and the third one also called it ST ACS. The common pathophysiologic mechanism for acute coronary syndrome is the rupture of an atherosclerotic plaque. If the plaque causes a partial occlusion of the cuprate artery, then unstable angina and non-ST elevated myocardial infarction may occur. If total occlusion of the cuprate coronary artery, then ST elevated myocardial infarction may appear. Acute myocardial infarction is a clinical syndrome that results from subtotal or total occlusion of the artery that leads to myocardial necrosis. And the ST elevated myocardial infarction is caused by acute complete occlusion, which can be corrected by thrombolysis. But in contrast, non-ST elevated myocardial infarction is caused by partial coronary artery occlusion, which can't be treated by thrombolytic admission. So, a clinical distinction between these two diseases is essential because of the differences in measurement. Part 2, manifestation. Classic symptoms of acute myocardial infarction, including prodrome, pre-infarction angina, and sustained discomfort, usually more than 30 minutes. The next contents is the ECG manifestation of acute myocardial infarction and the characteristic changes of ST elevated myocardial infarction, including the following three aspects. Necrosed area, we can find the Q wave. Injury area, we can find the elevated ST segment. And the ischemia area, we can find the inverted T wave. ECG stages of ST elevated myocardial infarction, including supraacute stage, we can find peaking T wave, and acute stage, we can find peaking T wave and ST elevated and Q wave. Subacute stage, in this stage, the ST may gradually return to the baseline. And then is the chronic stage. The inverted T waves persist forever or return to the normal. And this slide is very important. It shows the ECG location diagnosis of ST elevated myocardial infarction. From V1 to V3, it means anterior interseptal wall infarction. And from V1 to V5 or even to 6, it means extensive anterior wall infarction. For standard 2, 3, and AVF, it means inferior wall infarction. And this ECG presents the classic manifestation of extensive anterior infarction. For the lab finding of acute myocardial infarction, for this part, I think the cardiac biomarkers is very important, including CKMB and the TNI, TNT. At this part, we should know the time of the rise, peak, and last for these markers. Part 3, diagnosis and complication. The diagnosis of acute myocardial infarction is based on the classic history of ischemic chest pain and the typical dynamic ECG change and the dynamic cardiac biomarker. For the differential diagnosis, including angina pectoris, aortic dissection, acute pulmonary embolism, acute abdomen, acute pericarditis. The complications, including the following 5 aspects: dysfunction or rupture of the papillary muscle, rupture of the heart, embolism, cardiac aneurysm, and post-infarction syndrome. Part 4, therapy. The therapeutic management strategy for ST-elevated myocardial infarction is initial management, reperfusion therapy, initial antiplatelet therapy, and management in the coronary care unit. First of all, let's look at the first part, initial management, including oxygen, antiplatelet, beta blocker, nitrates, and so on. The second one, reperfusion therapy. The reperfusion therapy is the most important objective in the treatment of patients with STEMI. There are two main reperfusion strategies. The first one is thrombolytic therapy. The second one is PCI. For the thrombolysis, how to justify is successful or unsuccessful, including the following 5 aspects: reperfusion by cardiac angiography. Second one is the resolution of chest pain with 2 hours. 3, ECG, resolution of ST elevation. 4, reperfusion arrhythmia with 2 hours. 5, peak of the CKMB or TNI is advanced. Third one, the initial antiplatelet therapy, including the following drugs. The fourth aspect is management in the coronary care unit, including the following 2 aspects: ACEI, which can prevent the myocardial remodeling and heart failure, and statins, which can regulate the serum lipid and make the plaque stable. Okay, that's all. Thank you very much for your attention.